welcome everyone. I'm just gonna give it 1 or so minutes just to let everyone get on the platform. We're excited to have you join us for today's webinar. I'll kick things off in just a minute, but in the meantime, feel free to join our chat and drop in where you are tuning in from today. We love to have everyone introduce themselves so we can see where you all are from. Delaware, Florida, awesome, Wisconsin, Missouri, Ohio, Mississippi, San Antonio, Texas, my hometown. I always love seeing people from San Antonio.
Yeah, I think I saw a Loma Linda. I wonder if that's Loma Linda, California. I grew up right outside of there.
Oh, that's awesome.
So cool.
Oh, wonderful. I'm gonna give it just 1 more minute. Looks like we've got lots of people jumping on. We're excited to have you here today. Great. All right, I'm gonna go ahead and kick things off. Hi everyone, happy Wednesday and happy Pride Month. Welcome to today's webinar, LGBTQ plus mental health, the trauma of coming out. My name is Whitney Ball. I'm the Associate Director of Marketing and Outreach at Mental Health America's National Office, and I will be moderating today's webinar. A few notes before I introduce our presenter. The webinar is being recorded and you will be emailed within 1 week with the link to the recording. We do not offer CEUs for our webinar, but if you would like a certificate of attendance, we have a form for you to request one. We will post the link in the chat shortly, and it will also be included in the follow-up email that we send out. Last but not least, we built in some time for Q&A, and I know today's presenter is excited to hear from all of you, so please feel free to drop your comments or share your knowledge or post any questions in the chat, and I'll be collecting those. And with all of that, I'm excited to introduce today's presenter, Dr. LaNail R. Plummer. As a leading professional in the mental health field, Dr. LaNail R. Plummer is committed to improving the lifestyles of others through the aspects of mental health and character development. A United States military veteran, thank you for your service, and CEO and clinical director of Onyx Therapy Group, an organization she founded in 2013, Dr. Plummer has over 15 years of experience working with a multitude of clients and specializes in the care of young women, the Black community, and members of the LGBTQ+ community. Grounded in the values of integrity and awareness, Dr. Plummer believes that emotional, spiritual, and cultural healing is attainable for all. We are excited to have her with us today, and now I'll turn it over to you, Dr. Plummer, to get us started.
Absolutely, I'm so excited to be here. Whitney, you made me sound great. I just think that I'm LaNail, right? But here I am getting the opportunity to speak on the intersections of things that really matter to me. So the LGBTQ identity and mental health. So thank you for all of you all that are joining in with me today. I will be checking the chat as we go on. I definitely know there's question and answer segment towards the end, but the therapist in me wants to make sure that I'm acknowledging statements and questions as they come in as well. So as Whitney mentioned, I'm the CEO of Onyx Therapy Group. We are a mental health company headquartered in Washington, D.C., but with 9 offices in 4 states. So we're probably somewhere close nearby you. And I see a lot of you all from California, Southern California, and I'm a Southern California girl myself. So super excited to have you here with me. So let's go ahead and get started. As the CEO of Onyx Therapy Group, we believe in transformative healing. That is truly part of who we are. So this particular webinar will give opportunity and access for us to be able to think about transformative healing and what that looks like after one has come out, or even as one is anticipating coming out into the community as their authentic selves. So a little bit about myself again, CEO, 9 offices. I am a professor, a faculty member at Johns Hopkins University with a lot of classes that I love to teach and specialize in. And one of the new ones that I'll be working on is counseling in the LGBTQ community. So super excited to be teaching young counselors, novice counselors, or counselors in training about how to work with our specific population. As mentioned, I'm also a veteran of the United States Army, so super proud of being able to serve our country for 8 years and to be able to counsel our soldiers during their deployments. Personally, I am a member of the LGBTQ community myself. I identify as bisexual, very comfortable with the term queer as well. And interestingly enough, I knew that I was what we would consider different because I was growing up in the 80s. I knew that I was different around 7 years old. And so that's important because some people think that we have to wait until we're in our adolescent years, our young adult years to really identify how we see ourselves in terms of our orientation. But as a young child in elementary school, I knew that I had an attraction to both girls and boys. Not anything inappropriate, but just, little crushes here and there. I have 2 children, 17 and 14 years old. So I'm going through the processes with them as they're learning about their identities as well. And I officially came out just a few years ago at the age of 33. So super able and open to talk about what that personal experience was for me as well. Here's a picture of me and my family. You see that I'm married to my beautiful wife and my children here. I bet my son is saying that I need to update the picture because he's taller now and he would want everybody to see that. But here's a picture of us as we engage, as I want you to see a little bit more about me as I'm about to engage with you around a topic that is important and special to me as well. So some of our objectives for this webinar is that we're going to describe trauma through a clinical lens, a personal lens, as well as an interpersonal lens. And we're going to narrow that focus on the coming out experience, specifically for those in the LGBT community. So we're going to narrow these ideas around trauma and these experiences around trauma, specifically on the coming out period. And then we're going to we're going to talk about, and I'm going to show you all some different skills that can be used, or mindsets and questions that can be used as we create a new community or secondary families after we have come out. Feel free to continue to ask any questions during the presentation. All right, so in our DSM, for folks that are clinically based, we have a couple disorders in our DSM that specifically talk about trauma, more so stress. So in general terms, we spend a lot of time focusing on post-traumatic stress disorder, or PTSD, which was originally used and identified for military folks after war and the extreme traumatic experiences that they were having during their deployment and wartime. And over the last couple decades, we've noticed that people in general, not just military people, not just our service folks, but anyone could have experiences or even have the disorder of post-traumatic stress disorder, which tends to focus a lot on how extreme traumatic stressors actually cause a dysfunction in our social, occupational, and emotional realms. So that dysfunction means that we're not able to function the way that we used to before, that there is a baseline of normalcy for ourselves, not in comparison to anybody else, but a level of functionality for ourselves. And that has been shifted after a particular event or series of events have happened. One of the interesting things here, though, is that people tend to go right into post-traumatic stress disorder and skip over the precursor disorder of acute stress disorder. So acute stress disorder is a mental health disorder that emerges within either immediately or within 4 weeks after the traumatic event. Again, we're narrowing this focus here to our coming out experience. So that traumatic event could be the coming out experience, or it could be how people responded to us shortly after we came out. I really wanted to talk about the coming out experience as it relates to trauma because we don't spend enough time in it. We have normalized it as just a normal experience that people have, but it really has an opportunity to shift the way that one sees themselves, the way that one sees other people, and the way that they interact with their original families. As we know, some family members disown or have disowned members of their LGBT or members of that are in the LGBT community, and that in itself becomes traumatic for both the member as well as their family member. So let's go back to acute stress disorder. So if we use the coming out experience as a traumatic event, then we recognize that it involves the direct experience, the observation, the vicarious experience that creates a sharp sense of anxiety. Not anxiety in terms of how it is as a disorder, but the feeling of anxiety, because there is a difference between the feeling of being anxious and the actual diagnosis. And again, it happens within 4 weeks of the coming out event. What we also know is that if folks do not treat the acute stress disorder within 6 months of the event, they are likely to develop PTSD. Now, in the LGBTQ community, we often don't talk about acute stress disorder or post-traumatic stress disorder because, again, we have normalized our experiences and we forget that they actually were traumatic. Maybe in some of our times when we're talking to our friends, our coworkers, or whomever, we laugh off certain experiences, or we get sad around certain experiences, but we don't really acknowledge how that has been traumatic for us, and it has shifted the way that we function in our normal lives. Again, the way we function in our social, occupational, and emotional realm. So I wanted to start off the webinar focusing on these particular disorders because they are highly prevalent in my work in the LGBTQ community. I realize that these two disorders are highly prevalent in the LGBTQ community, but are often masked as depression or anxiety. And we really need to be treating the trauma that is present as opposed to the symptoms of depression and anxiety that come along with acute stress disorder and post-traumatic stress disorder. I know that sounded like a lot. So again, if you have any questions, feel free to drop them in at any point. So both post-traumatic stress disorder, both acute stress disorder and post-traumatic stress disorder tend to happen after the traumatic event occurred. However, we're doing a lot of research in the mental health field now around what we're calling persistent traumatic stress experiences. And that is a different type of, it will be a different type of stress or trauma disorder that specifically highlights when one is still experiencing the trauma, that the event occurred and that the trauma is recurring over time. Think about a person who has come out and are still living at home with their family who is not supportive of their LGBTQ identity. They may be hearing and experiencing trauma every single day after that initial event, and they are consistently now living in a traumatic environment, meaning that the trauma didn't stop. It's consistently happening. And what that does for our brain is that it causes our limbic system, the back part of our brain, to be overactivated, and it causes our amygdala to get enlarged, which subsequently prevents the full flow and function of our frontal lobe, which is where we're making a lot of decisions. So what I'm saying in more simplistic terms is that when one is consistently living in a traumatic event, they are more sensitive than they were before, and they're probably not thinking through every element of their life or their decisions the way that they are actually capable of. So something that we definitely need to be thinking about as we're living through trauma, as we have come out of trauma, or as we are supporting those in the LGBTQ community who have had trauma. In my experience as a therapist, again, another disorder that I see specifically connected to the coming out experience is what we call reactive attachment disorder. Historically, reactive attachment disorder was focused on children and their vulnerabilities when they have been in an environment that did not have secure attachment. So when they were in an environment and they didn't feel completely connected to their caregivers, to their parents, to their community. However, we also recognize that when a person has come out and they have experienced trauma, they also tend to show many of the symptoms of reactive attachment disorder, specifically this withdrawal and detachment or unresponsiveness, which we sometimes call depression, when in actuality, it could be a symptom of reactive attachment disorder. It may be a disturbance in social interaction that can sometimes be masked as a social anxiety or a disconnect with others. It could be considered an organic failure to thrive, which historically has been connected to young children, but can also affect us as adults, in which we stop growing or thriving, our body, our organs stop growing and thriving the way that we need to. So here you see a lot of symptoms that kind of overlap with depression and anxiety. So whether you are part of the LGBTQ community and kind of thinking that you may be dealing with depression or anxiety, or you are a provider, I really want you to consider, is there a possibility that there's actually a reactive attachment disorder that's in play as opposed to the depression and the anxiety? That's important because it determines how you will be treated in your therapy sessions, and how you will interact with your children, how you will interact with others as well. I love that the chat is moving the way that it is, and people are sharing their ideas and their experiences. I want to talk about those 4 particular mental health disorders and the implications that they have on the LGBTQ community. What we see is that with acute stress disorder, there is this maybe one particular incident that has changed the course of our life. We've been trekking along, living our life the way that we normally do. We decide that it's time to come out, or someone has decided for us, because sometimes, unfortunately, people have outed us, and that has changed what we thought our future was going to look like. That's specific with acute stress disorder. It also creates this fear of coming out for some folks because of vicarious observation. So they saw someone else come out, they saw how the family and the community responded to them, and that in itself was traumatic, and it prevented them from coming out. And that is, again, associated with the acute stress disorder. For some folks, it means that they come out, they experience this traumatic experience, they have this traumatic experience, and then it forces them back into the closet. They are so fearful that everyone is going to interact with them or see them the way that they they are so fearful that everyone is going to treat them the way that that initial person or the initial group of people did. So they retreat and they go back into the closet. And for years, they continue to try to live a life or an identity that is not true and authentic for them. With acute stress disorder, we also see that this may be where we have suicidal ideations due to shock and concern of management of the possibilities, meaning that they become suicidal, or they have suicidal ideations, or we, rather, part of the community, have suicidal ideations due to how people have responded to us and the shock associated with that, but also due to our concern around, can we manage how people will interact with us in the future? Can we manage how people will see us? Can we manage how people will interact with us? And if those experiences are all happening within the first 4 weeks of coming out, then it's likely that a person is experiencing acute stress disorder. As we move on to post-traumatic stress disorder, we are now having these intrusive thoughts. So where we are sitting and just living life and have these thoughts that just come in on their own, unprovoked, unmitigated, and they are causing us to have difficulties around how we manage our life. Here, again, like I mentioned, and we'll emphasize, in post-traumatic stress disorder, the presentations of some of these symptoms may actually look like generalized anxiety disorder or depression, major depressive disorder. But again, whether we are the person experiencing this or we are the provider supporting the folks, we need to be able to flush out, Is this actually depression? Is this actually anxiety? Or is this rather a traumatic disorder? Is this rather a reactive attachment disorder? Because again, we need to treat what is the root and not just the symptom. In this particular disorder with PTSD, we also see that there's a disconnection of self and identity. We start living these out-of-body experiences, or we start creating these lives that are not truly reflective of who we are. And sometimes that creates a sense and a feeling of shame as well. When we get into the persistent traumatic stress experiences, those that are consistently happening, we tend to have this generalized fear that can also look like numbing. This is where we may hear people say, oh, I'm okay, when they're actually not, or I don't really think about it, or it's just how it is. They are now numbing because they recognize that for them, they don't see a way out. They've come out, they've expressed who they are, maybe they've been forced back into the closet, or they've been separated from their family, and they just try to normalize their experience, although they're living, although we may be living with pain inside. It appears to be a sense of acceptance, but really the individual still has a desire for change within themselves, but more importantly, change within the community that's helping and processing, that could be helping and processing with them. When we think about the implications of coming out and reactive attachment disorder, we're looking at the fact that the family, the person now feels that there's an insecure attachment. Maybe now they're showing signs of ambivalence with people who they care about, or they're showing signs of avoidance with people with whom they had once cared about, or maybe even disorganized in that they want to completely disconnect as well. The other implications for this, and that I see a lot again in the work that I get to do, is that there's a fear of establishing new relationships. And so that's what really brings us to this webinar today, because oftentimes what I've experienced as a therapist is that folks will come out, they've been disconnected from their family, they have trauma that's associated with that, with both the coming out experience and being separated from their family of origin or their community of origin, and subsequently they have this fear of establishing new relationships, because the fear is rooted in wonder if someone will still accept me, if I am worthy of love, can people love me the way that I need to be loved, etc. And as such, we notice in our work that they start to self-sabotage to prevent rejection. They will reject others and find excuses to reject others and separate from others before there's an opportunity for someone else to reject them. So they intentionally, let me pause there, not intentionally, sometimes it is subconscious, as a defense mechanism, they will sabotage to prevent rejection because they don't believe that they're capable of handling any other types of rejection. And lastly, that there's an inconsistency in relationships and connections, meaning that sometimes they get close to people and then they completely separate again. And it's like this roller coaster and this wave around whether they have close relationships, whether they feel that they have connections, or they do not. I see a couple of questions in the chat as well. You know, the extrovert in me really loves the engagement here. Yes, there has been quite a few publications written on the work. I'm going to have my contact information at the end of this presentation, and you can send me a quick email, and from there I'll send over the articles that I've used. In our resource page, towards the end of this presentation, you're going to also see a number of different articles, websites that can be used as you process this information or you present it to other people as well. So as we, again, narrow that focus on the coming out community, I've pulled some quotes from some of the clients that I've worked with or some of the conversations that I've had. As mentioned earlier, I'm developing a course for Hopkins called Counseling in the LGBTQ Community. So I've already done a lot of research, and some of these quotes may be coming from those people as well. So here again, we're looking at quotes that connect to the trauma of coming out and the implications on those particular mental health disorders and how they have a dysfunction in someone's life. So because of that, because it's confidential, I did not use any initials, but I did give the actual quote. So here we have, everyone doesn't have the privilege to come out. Sometimes it results in death, and not just emotional death and rejection, but real life. Ain't more life, real life, death. And if that's not scary, if that ain't scary, then I don't know what is. So we also have, it was cool at first, but then we and my parents didn't talk about it for a year. That's a whole year when I was in limbo. Are they okay or are they not okay? Is this fight because I'm gay or because I did something wrong? That particular quote came from a person in their youth who came out to their parents, and their parents did not talk about it anymore for that year. And for that entire year, this particular client didn't know if their parents were picking fights with them because they were gay, or picking fights with them because they had actually done something wrong, or just kind of projecting and displacing some of their feelings onto the client. And that was more so related to that persistent stress environment, because the client was consistently in stress, even though the parents had not rejected them or kicked them out the house. It was this sense of unknown that caused the stress to continue. Another quote is, I was told I'm going to hell. I mean, who the hell wants to go to hell? Like with the devil. So I just kept on pretending. I pretended until I realized that hell after death is better than hell on earth. So here I am, hell-bound and happy, but I don't talk to my family anymore. And with this particular client, I was able to work with them based off of reactive attachment disorder. Another quote was, I don't have family. I mean, they still get together on holidays, but I don't think that they talk about me. Nobody knows where I am or what I'm doing. The worst part is, I don't have anyone to say, remember when blank and blank happened? Because nobody in my new world knows. Sure, I have a new world, but I want my old world too. I want a normal world, but I'm gay, so I have to choose. Well, I didn't have a choice, but I try to pretend like I did. Then I won't be so sad all the time. So again, processing the trauma that is connected to the work that they have experienced. A couple more quotes. They kicked me out. This was after they saw me in the closet kissing my best friend. When conversion therapy didn't work, they thought the world would make me less gay. So they kicked me out. And I haven't gone back. I wonder if they miss me, but they probably don't. They don't live their real lives, and they expect me not to live my real life either. This came from a particular client who had gotten kicked out, but while in therapy talked about how nobody in their family truly lived an authentic life. There was lots of infidelity in their parents' marriage. There were lots of secrets in the family. And this particular client became courageous enough to try to live their true authentic life, but in reality experienced the consequence of getting kicked out. So where this client was trying to trailblaze and be authentic, the consequence was that they were forced to be disconnected from their family. Another quote, I have a new family. They may leave me too, but they're all that I have right now. I'll probably have lots of new families, because what is family anyway? And this is where the client is trying to figure out the existential meaning behind family and connectedness, and processing that again through the traumatic event of coming out and being kicked out of the home. Another quote, I bring blank, talking about their partner, I bring blank home, but they still call her my friend. and make her sleep in a separate room. It sucks, but at least we get to celebrate some moments together. I don't think my folks will ever change. This is the best that I can get, and it's better than nothing. And the last one that I'll present today, my mama and daddy didn't come to my wedding. They said that they would go to hell. Even now, they won't ask me about her, and I won't talk about her too. We've been married 5 years, and my mama doesn't ask me about my wife. Maybe if I have a kid, it'll change. But for now, neither talk about the other, and I'm in the middle. I want you to just sit for a second and process the emotions behind some of these quotes. I see that some of you are saying that they're powerful and they really show the reality of the LGBT community, that some of them are giving chills as well. And yeah, the processing of what is family anyways, such an existential question to ask during a time of processing trauma. Feel free to jot down and write your ideas as you're processing what this means, either for you and your coming out experience and the normalization of these quotes for the LGBT community, the sad normalization, or as a clinician and provider and what this means in terms of how you move forward treating your clients. Yeah, it takes a lot of emotional strength to experience this, to experience it and to want to go on, to experience it and to be living with the trauma, to experience it and be living with the reactive attachment disorder and wanting to move forward and have a what we consider healthy life, but don't necessarily know how. So let's talk about that how. Here I have a question. Oh, internalized phobia of your own sexuality. It's such a real thing. I don't have any tips just right now. I do want you to email me and I could give you some tips then. I don't have any that are coming to mind in this very moment, but internalized phobia is a real thing. Internalized homophobia is a real thing. And it creates its own experience around trauma when you know who you are and what you are experiencing and you are afraid. You are afraid and scared of that as well. Will I talk about the difference and struggles with being Black versus being Black and identifying in the community? Interestingly enough, I've done a couple presentations on the intersections of race and gender and LGBTQ community. Clanisha, if you could please, again, send me an email, I could definitely give you some of the information from that. I'm not gonna spend a lot of time talking about the intersections of race and gender, but more so focused on the coming out experience and the trauma that's associated with that and ways that we create new families as well. Again, the extrovert in me is loving all of these comments. So keep them going, and I am going to move forward with some more of the slides as well. So going back to that attachment piece, we recognize that many times folks in the community, their attachment style changes after they have experienced trauma from coming out. I like to include this particular graphic because it kind of demonstrates what happens, what can happen. So in a secure relationship with family or with the original community, the community of origin, we have folks here, and don't, please, this is the best that I could do with the graphic. I recognize that it is extremely heteronormative, which is not a reflection of our community or the community we're talking about now. But the securedness is really talking about or demonstrating how people are close together, how they're holding hands, how there's close proximity, and how there's safety in that. There's safety when you could huddle up with folks. There's safety when you can use each other's body as warmth, emotional warmth, and physical warmth as well. Here we have another image of ambivalent attachment. And so after coming out, some of our folks may move from secure, or maybe they were never secure, to this sense of ambivalence. What I want you to pay attention in this particular picture is that the person here, the young person, we will consider that the person that's in the LGBTQ community, they still want a connection. You see how their body is leaning towards these people here. They want this connection, but they're hesitant. They have this one leg leaning forward to say, I want to engage with you, but my hands are behind my back and I'm not fully sure that you're able to accept me as I am. I'll come and get a little close with you, but then I'll pull back as well. I'll get a little closer and then I'll pull back because I'm not quite sure if you can accept me as I am. In the avoidance, we see here that a person has turned their back against this sense of security here. And maybe it's actually the opposite, of which the parents or the original family has turned their back. But either one, it's a matter of somebody has turned their back against another, but they're still in movement, meaning that there's still a possibility that things can turn around, but I'm just not going to intentionally engage. With ambivalent, we have folks who want to engage but have hesitation. With avoidant, we have people who are not really willing to engage at the time, primarily because of fear or other emotions that are there. And then lastly, we have disorganized, and you see that the person has kind of planted their ground and have decided that they are not going to connect much anymore either. And here we have where a person is kind of given up, if you will. Why this image is important, because as we create new and secondary families, if we've had to leave our family of origin for whatever reasons, we must know where we stand right now with our own attachment. And that attachment doesn't have to be with the family of origin. It could be with the new family that we're trying to create. It could be with our new community that we're trying to create as well. Because once we know and we have our increased self-awareness around what our current attachment style is, based off of the trauma that we have experienced, it will inform what type of steps we need to take to develop a new family, to develop a new community that's going to be loving and securing for us. I'm going to send you this link here. Next week, when Mental Health America sends out the recording for today, I'm going to make sure that this link is in there as well. It's about 11 minutes long, so we don't have enough time to really watch it together and process it, but it is something that I want you to consider watching, something that I want you to actually watch when you get it next week and you watch this recording again. It is about emotional first aid and how we take care of ourselves and fix ourselves after we've experienced trauma, how we tend to mend our emotional wounds after someone has hurt us and cut us down or made us feel significant ways that cause disorder and dysfunction in the ways that we see ourselves and the way that we interact with others. So here, I've listed out quite a few tips based off of my own research and my experiences in working with people in the LGBT community, like myself, and some things that we should consider as we build new families, as we build secondary families and new relationships with ourselves and with each other. So I want to just give a second because there's a lot of language on here. So I want to give about a minute or so for you to look at some of the language and tell me what stands out for you. And then I'm going to go over these 9 particular aspects of how we rebuild our families and how we build secondary families and how we rebuild ourselves after trauma. So use the chat and let me know what stands out for you too. Yes, you will get the recording after the presentation. Within 1 week of this presentation, you'll have the recording and you'll have the link to the TED Talk. Pertaining to the slides specifically, you can email me and we can talk about elements of the slides and elements that you need. You won't get a full copy of the presentation. Yes, healthy boundaries, giving yourself what you lacked or what you learned from others. Yes, increasing that self-awareness, especially true as we're thinking about our attachment styles. Yes, that honest feedback piece and the questions that we ask ourselves or that we ask others. Unconditional positive regard. You all are on it. I love it. I love it. Yes, talking that positive self-talk after trauma. All right. So again, the context of we have come out and then we are dealing with the trauma that comes with that coming out experience, whether it's acute stress disorder or post-traumatic stress disorder, whether we're still living in it with persistent stress environments, or we are actually experiencing reactive attachment disorder. We have to be intentional about how we create our new relationship with ourselves and our relationship with others, because remember, the trauma causes a dysfunction of how we operate in our lives. It is a reflection of a disorder, meaning that the order that we once had is not there anymore. And the functionality that we once operated under is not there anymore. When we think about our relationships with our families of origin, a baby, a young child, a toddler is not taught how to be in that family. There's a sense of family culture and socialization that is experienced through words and through actions, but nobody says, if you want to be a part of this family, you have to increase your self-awareness. If you want to be a part of this family, you have to be intentional. If you want to be a part of this family, we really need to talk about your consistency and predictability. Those are not things that most family members say to each other when they are in their family. But because you are creating a new relationship with yourself and you are creating secondary families in your communities that you are currently living in, then there's some intentionality that has to be in place as you create those new families. Like with anything that we create and we construct, there are skills and elements that are part of the building blocks. And here I want to share some of those with you. So we have self-awareness. When we are building these new relationships with ourselves and our families, we have to be aware of ourselves. We have to accept ourselves. We are already a masterpiece. We are already created by the universe with our uniqueness, whether it's the uniqueness of our gender or the uniqueness of our hair, maybe it's the uniqueness of how we think, the uniqueness of how we learn. I don't really like this idea of normalcy because we are all unique, right? So accepting and being aware of where you are unique and what your particular needs are. And as you create that awareness, and you give yourself grace, right? Giving yourself grace, we extend grace to a lot of people, but giving ourselves grace as well. There's a series of questions we can ask ourselves. I am already amazing. I am already where I am supposed to be. I am already this person. Where do I want to grow? And can I grow without being self-critical? Can I grow without comparing myself to others? What do I want to know about myself? And what do I want to learn about myself? So I have this as the first one because our relationship with self is paramount to any relationship that we have with anybody else. As we continue our relationship and continue growing and developing our relationship with ourselves, it makes it a lot easier to communicate what we need, to be vulnerable because we feel secure in ourselves, because we know ourselves. And it does take time to get there, but it takes intentionality as well. There's this vulnerability that has to be present, vulnerability with self and vulnerability with others. And that's the expression of needs and wants. But first you have to know what you need and want, which is why the self-awareness is there. So what do you need? What do you want? And it's okay if you don't have all the answers, but that you have to be open to learning about yourself. You may not know what you need. You know, if we go back into traditional love languages, right? I'm a touch person. But in one moment, I may actually need validation. Who knows? But I'm open to learning about myself, to seeing what I need from other people as I'm recreating a secondary family, or excuse me, as I am creating a secondary family, or I'm recreating my relationship with myself. There's also this place of allowing others to teach you about yourself. You know, sometimes we get onto these high horses of self-awareness and we think that no one else can teach us about ourselves. But people can teach us because they often mirror us. So we are attracted to people who we are often attracted to people who we see similarities in, or people who we don't see similarities in, and that they annoy us, but they annoy us because there's a part of us that we would consider our shadow that's still there. So some questions that we can ask ourselves, you know, am I ready to be vulnerable? Am I experiencing shame in this moment? How can I provide safety to myself as I am being vulnerable and after I have been vulnerable? The consistency and predictability. There's a video out called the Still Face video that specifically relates to attachment. And what we learned from that video, and much research that came afterwards from our theorists of Bowlby and Ainsworth, is that safety is built in security and predictability. So when somebody is predictable, when they are consistent, when we can anticipate what they will say or what they do, we tend to feel safer. And so the questions we would ask others, the first two are about asking ourselves, but as we ask others, we would ask another person, what does consistently look like to you? And what can I predict? And will it stay the same in each conversation and interaction? What are you going to do each time I say something? What are you going to do if I say something that's harsh, if I say something that's vulnerable, if I say something that's full of excitement? Can I predict that? Because that predictability is where we tend to feel safe. And when we feel safe, we're willing to take more emotional, strategic risk. That unconditional positive regard, oh my goodness, I just looked at the time, I get so excited in this work. But that unconditional positive regard, so hoping for the best, looking at the world as glass half full, having grace and mercy, and asking people, can they have grace and mercy towards us as well? Are they capable of seeing us with the benefit of doubt? Are they capable of seeing our true intentions and the trueness of our essence, and not necessarily being distracted by some of our behaviors that may be a reflection of our traumatic experiences? When we are being ambivalent, it's not because I don't want to be with you and I don't love you, it's because I'm actually scared that you're going to reject me. Can you see that in me? Are you capable of seeing that? Will you choose to see that? The 6-step communication process as we go into communication. So 6-step communication process. Those are terms you can Google and research, as well as the 4-step problem solving process. While we're building new relationships with self and with others, we're also looking at honesty, how to be honest, but tactful. How can we be intentional and tactful? And that may mean that you start thinking about the outcome before you actually start talking. And not that it stops you, not that the fear of the outcome stops you, but rather you change the time that you talk, or you change the tone of what you're going to say, or you let them know from the very beginning what you want the outcome to be. Healthy boundaries. So knowing and communicating your limits. And it's okay if you have limits that are different from other people. That's part of your self-awareness. I know that I have particular limits that are very different than my wife's limits. She has a different emotional cup than I do. So she can handle certain things differently than I handle them. And it's okay if our boundaries are different from the people that we're building relationship with, just as long as we say it. One of the other things about healthy boundaries, and I don't want to get too far into it, but want to say that if you are experiencing mixed signals from someone, I want you to equate that to them saying, no, I'm not ready. Sometimes we get mixed signals from people and we say, oh, I'm just going to give them more time, or, oh, I wonder what this means. And there's been many times, many hours clients have spent with me trying to process mixed signals, when what it really boils down to is the person having a passive aggressive way of saying that, no, they're not ready. They don't want to be a part of that. So if you are one that gives mixed signals, or you're experiencing someone with mixed signals, it may be time to go ahead and reduce the interactions that you have with that person, or for you to explore for yourself why you're not ready and if you are capable and wanting to be ready. And again, it may go to that question of self around comfort and opportunities to stretch, to sit still, to teach, or to leave. Here, we also have, and going back to healthy boundaries, I want to also highlight the third point. You must adhere to your own boundaries before you expect others to adhere to your boundaries. So if you tell someone, don't speak to me that way, then don't you dare speak to yourself that way either. If you want someone to respect that you need self-care time, then you need to adhere to your self-care time. If you know I need to go to bed at 9 o'clock every night so I can get my beauty rest, then you go to bed at 9 o'clock. And when somebody calls you at 9:30, don't answer the phone. Because if you don't adhere to your boundaries, they're not going to adhere to your boundaries either, right? Then we have positive self-talk. So being kind to yourself, making sure that you're speaking to yourself the way that you want other people to speak to you. That positive self, here's the question. Would I say these same things out loud or to someone else that I love? Sometimes we're super critical on ourselves and we beat ourselves up a lot. And and subsequently, we start to believe the things that we say. We start to believe the things that we hear ourselves say. But if you wouldn't say those same words to somebody out loud, then you don't have any right to say it to yourself either. Because your primary relationship, your first relationship, especially after trauma, is that relationship that you have with yourself. Let's go on to intentionality. So as you're building and creating new relationships with other people, you're also going to end with yourself. You're going to be intentional about the conversations you have, the interactions you have. And just the same way that we're intentional with our work, we need to be intentional with our emotional work. That may mean that we write in our self-care time. That may mean we write in our meditation time. That may mean that we actually respect our own boundaries. That may mean that we ask a person, are you ready to have this particular conversation with me? Because some people may not be ready. And if you proceed with that information before they're ready, then you might be setting yourself up for failure. And here with that intentionality, I'm talking about having real and deep conversations, because that is part of building relationship with self and part of building relationship with others as well. Last one, that honest feedback. Ask for and tell the truth. There is definitely a time for compliments and flattery as you're building relationship with self and building relationship with others, but there's also a time for constructive feedback. And constructive means to build. We are building our relationship with ourselves. We are building our relationships with others. So yes, we can give compliments, we can flatter ourselves, we can flatter other people, but we also have to be honest and give honest feedback. Make sure that we're using tact and timing, and that here we're focusing on logic as well. So question to self would be, is this my truth, or is this just ruled by emotion, hurt, and protection? Am I telling you what is true for me, what is logical for me, that this is the boundary for me, of which I am aware of, or am I just saying something to you because you hurt my feelings, or because I need to protect myself because I think you might hurt my feelings? So important things, important questions to think about as we are rebuilding our relationship with ourselves after trauma and building secondary communities and families after our trauma as well. So your takeaways: trauma and stress disorders are often masked as depression and anxiety. So be sure to treat the root, not the symptom. Trauma is not a permanent disorder. It can be acknowledged, addressed, managed, cope with, and have elements of resolution. We can rebuild our relationship with ourselves with the same intentionality of how we build relationships with others. Once we rebuild our relationship with ourselves, then we focus on building our relationship with new people. Sometimes you just have to talk. That is where talk therapy happens. Sometimes we hold all of this trauma inside and we hold all of this hurt inside, but it's like an infection, and it spreads in our mind and it spreads in our emotional body. But when we talk and we participate in that talk therapy, it's like opening up that wound and getting that infection out. And that infection may be ugly and it may be gooey and it may hurt, but it's better for it to be out than for it to be in. Sadly, we normalize trauma and coming out, but your story is unique and your feelings are normal and relatable. So talk through them. Building relationships require intuition, which is that organic attraction, as well as intentionality, which is the use of skills that we just discussed. Building relationships after you've been hurt by your family of origin will require strategic risk, extended trust, and internal safety. And the last thing, there is purpose to your life, and it involves others. We are born of a person and we are to live with people, but it is like a puzzle. You have to be patient and you have to find the perfect fit, the people who perfectly fit into your world. You are a 1,000-piece puzzle, not a 24-piece puzzle. So take your time and get to know your emotional needs, your emotional grooves, your emotional edges, and your emotional curves as well. I got so excited and we are running out of time. Here are some resources. This resource slide will be sent to you along with the recorded presentation and that link. Here are a couple articles that I think a couple folks mentioned as well. Don't get caught up in the pastoral work or the bisexual work. Those are titles that are often used to grab a reader's attention, but the meat of the articles are perfect. And if you email me, then I can give you some additional resources as well. Here is my contact information. So my company is called Onyx Therapy Group. You can Google us. You can also Google my name, Dr. LaNail Plummer, and all of this information will come up. I hope that you follow us on Instagram. We give tons of resources and support, especially as we go through Pride Month, or Black History Month, our months around identity. We give tons of tips of how they connect with mental health as well. And then my personal IG page, just in case you're curious about who I am, because as you see, I am full of life, and my Instagram name is Mahogany Sunshine. Feel free to email me so that you could get additional resources, or to process anything that we've talked about as well. I see a lot of thank yous. There were some questions on there as well. I appreciate all of you all who mentioned that this presentation was valuable to you. When I am building out presentations, I'm often thinking about the audience and using my intuition and spirituality to determine what you all may need, what we need, because these are healing conversations for myself as well. So I appreciate you all. And here's the information of how you can get in contact with me. All right. I think we did good on time, Mental Health America. So
that was an amazing conversation. As both an ally and a training mental health professional, I can say from firsthand experience, like, dang, my hand hurts from writing down so many notes. So that was awesome. It seems like everyone else got a lot out of this. As a reminder, we will be sending out an email with all the info you need, including the link to get your certificate of attendance if you didn't get that in the chat, and the TED Talk, and a recording so we can all go back and rewatch this. So thank you so much for joining us. I want to make just one quick announcement from MHA's side. If you are watching this and your organization wants to get more involved with MHA National, I'm going to post the link to our associate membership program in the chat, so you can consider becoming a member, an organizational member. And with that, happy Pride Month. Thank you so much, Dr. Plummer, for joining us. This was such an insightful conversation. I really appreciate your time.
No problem. I appreciate you all. I appreciate you, and I hope that I get to interact with you some more, right? So email me, follow us on Instagram, LinkedIn, Facebook, all that good stuff. And if you guys need anything, I'm here to help and to heal. Thank you.
Thanks, everyone. Have a great day.